coming to HealthFinders for, I'd say, close to 3 years, just under 3 years. They've been like super amazing about like meeting me where I'm at and making sure that I have all my needs met, even when I didn't have a license, didn't have transportation, was homeless, living up in the city. It's like they really made it work no matter what I was going through.
What we do at HealthFinders in working with patients with opioid use disorder is offering a low threshold, low barrier approach. So we have a lot of flexibility to figure out what somebody needs and how we could get it to them.
Emily and HealthFinders has helped me so much. Like, she has walked alongside of me throughout my entire journey, and with like support and compassion and non-judgment, not like a lot of other doctors. It wasn't like that with Emily. Like, she's cheered me on all along the way, even when I had slips and bumps in the road. Like, it didn't matter to her. The fact that I still showed up and still continued to reach out, like, that's what mattered to her. So she's been really huge in my journey.
I think what we have is just access to so much. You know, you could say that we have, we're a clinic with fewer resources, but we are wealthy in the community partners we have, the other organizations, the pharmacies, community health workers that we have access to, our peer recovery support and specialists. We, at a moment's notice, through phone call, email, text, I could connect with somebody. And I think that's amazing because our reach is so much further than these 4 walls, than the clinic room.
Yo soy paciente de HealthFinders ya de hace mucho tiempo. Emily es mi doctora, es muy buena gente, muy buena doctora. Me ha ayudado mucho, pero yo nunca le había dicho que yo tenía un problema de drogas. Desgraciadamente había tenido muchos problemas con mi familia. Mi esposa me había abandonado y me dijo que si yo no buscaba ayuda, ella ya no iba a dejar verme a mis hijos. Entonces yo no quiero perder a mis hijos ni a mi familia.
Seeing the patient from when they first walk in the door, and sometimes they're in emotional distress, their life is out of control, and just seeing the progress that they make within just a couple weeks, just their whole persona, their whole how they look and how they talk, and then seeing them. I actually just saw a patient not too long ago. He's been sober 8 months, and just the difference that, how they look and how they talk and how they present themselves. Where when I first met them, they were experiencing withdrawal and those kinds of things. So just seeing the progress that people make when they follow the plan and do things that are positive in their life.
Pueden ocasionar las drogas. Estuve a punto de perder mi familia, mis hijos, mi mamá. Tuve problemas por la policía, nada más por andar usando esas cosas. Entonces, acá estoy dándome palabras que tal vez le sirvan a alguien de no poder, que no hagan drogas, o si hacen drogas, hagan lo que yo, buscar ayuda, y sí se puede ayudar uno.
Well, I think that HealthFinders gives everybody an opportunity. We don't, just because they don't have insurance or because they don't have the means to paying for a service. I think we just help, anybody that wants to get help.
Estoy mejor sin las drogas y con la ayuda de HealthFinders que me brindó, y mucho apoyo. La verdad, estoy feliz ahora.
So I'm a peer recovery specialist over at the Community Action Center, and I get to walk alongside people who are also struggling with substance use. Substance use is a very lonely thing. It's isolating. It's all of the bad things, and these people helped guide me to There's so much shame and guilt attached to addiction that people don't talk about it. People don't want to be labeled as that addict or a junkie, especially when they're in recovery, because that's not who they are anymore.
Having the opportunity to have somebody like Ashley as a colleague, a coworker, a support for me is incredibly rewarding and gives me so much hope for what we can do.
You never know what somebody's going through. You never know the things that have happened. You never know, but recovery is possible. A beautiful life is possible. There is support out there. There is help, and it's possible. HealthFinders is hope. HealthFinders is love and support and compassion. it's hope.